two totally different experiences to where you're not sure what quite that guy actually was and what this guy was, because it can be so vast in the treatment aspects. Now, it's a good thing and a bad thing, but for most, it's a good thing. So, the way I got into this is I graduated from Texas A&M University in 1999, graduated from Parker University in 2008, did several residencies and internships afterwards, got a couple of certifications, chiropractic clinical neurology was one. Trained through the Autism Research Institute is where I learned a lot of these, biomedical techniques. I am a certified acupuncturist, so I don't practice. It just takes way too much time. Someone's got to be laying there for about 28 minutes in order for the needles to have effect. I did some of that when I was early in my practice, but I don't do much of that anymore. I refer out for acupuncture, which helps for certain conditions. Right now, I'm clinical director at our Brainworks at Pediatric Developmental Center. It says Pediatric Development Center because that's how it got started. It's a family practice, so I see just as many adults as I see kids. As a matter of fact, it's probably about a 40-60 split, where it's 60% adults, 40% children. In chiropractic, they don't limit us to pediatrics like they do in Western medicine, more traditional medicine, where if you're a pediatrician, you can only see children 18-year-olds and younger. Not family chiropractic or family practice. I do postgraduate instructor work for Parker University, where basically I just talk to other doctors and train and certify other doctors to do basically what I'm doing. And then I'm also a peer-reviewed doctor for JAD, that's the Journal of Autism and Developmental Disorders. Basically, when someone publishes an article, they shoot it out to hundreds of doctors and give people the opportunity to basically poke holes in the theories or research that is being presented. It's a great way to get information through peer-reviewed literature. If you look for textbooks or information in textbooks, it's 8 to 10 years old on average. Peer-reviewed literature is the best way to get your medical information. Google Scholar is where you want to go for that. If you go to Google and you punch in omega-3s and cardiovascular conditions, you're going to pull up every Tom, Dick, and Harry's article on omega-3s. If you go to Google Scholar and you type in omega-3s and cardiovascular conditions, you're only going to pull up peer-reviewed literature. That's cool. Only literature that has been peer-reviewed and accepted by the general medical world. All right, let's get started on this. By the way, complementary alternative medicine. I am not here to replace your general practitioner or your family doctor or your internist or anything like that. I'm here to do just what the title says, to be complementary and alternative to those means of treatment. So just keep that in mind as we're talking about all this. I'm not here to say, yeah, get off your statin drug and do this. Every single case is different, so just make sure that everyone needs to analyze their condition specifically. And these are guidelines essentially. So what are we up against? You know, whenever we talk about the current status of health today, my goodness, there are just a myriad of conditions that are plaguing us. Heart disease, joint pains, neurological disorders. I mean, how many women are on SSRIs or antidepressant medication? Men and women, but it's definitely predominantly women. There's a myriad of conditions that are plaguing us today, and we don't know why. Children being born on the autism spectrum. When I first got started in this, roughly 8, 9, 10 years ago, it was 166. And then it went to 150, and then it went to 1 in 100, and now we're down to 1 child in every 66 children are being born on the autism spectrum. So what in the world is going on? Why are we having this decline in health, if you will? Well, this is what we're up against. So we're up against genetics, of course. We have a few systems in play: the neurological system, gastrointestinal, metabolic, and immunological systems. Those are systems of the body that make you function, make you who you are. These are our exposures that are so different today than they were when you and I were born. They are so different today. Food additives are extremely high, or toxins are higher, pesticides. There's pesticides being used today that were not around when you and I were born. Viruses, bacteria, yeast, fungus, all of those things are very prevalent in today's society. These things affect these guys, which will affect all of those. Some people just have neurological conditions, some gastrointestinal, immunological, and some metabolic. But for the most part, because one condition kind of begets the other, most of us lie somewhere in these overlaps here. This is an awesome study. Well, there's nothing awesome about it, but it was interesting, I should say. So, there's 287 toxic chemicals present out of 413 that were tested in umbilical cord blood today. That is nuts. And those toxins come from the environment. People always say, where do they come from? They come from the environment. Our food, the air we breathe is the biggest exposure that we have. That's where things come from. There's new chemicals being developed every single day. New plastics, new preservatives. And we don't really know the long-term effects of these things. But anyway, I thought this was an interesting study. 180 of those have been tested to cause cancer. 217 of them are toxic to the brain and nervous system. What do these things do? They can alter your genetic makeup. The term that is used for this is called epigenetics. So a lot of people think, oh, well, my genetic makeup is my genetic makeup, and it is when I was born as it is when I leave this earth. But that's not the case anymore. They're finding that people that didn't have, or that had relatively normal genetic makeups as a youth, now have some abnormal chromosomes. Those are called de novo chromosomal mutations, and those are affected by the environment. So that's something to really consider, that you can develop allergies later in life that you didn't have as a child. You can develop conditions later in life that you didn't have as a teenager or as a young adult due to these exposures that we have. So the assessment is what I'm here to talk to you about. When you go to your GP or you go in for a normal annual, things like that, you're going to get a complete blood count or CBC. You're going to get a CMP, comprehensive metabolic panel. They're going to check your blood sugar, your liver enzymes, things of that nature. Most of you in this room will probably come out A-okay in those things. Although you may go in there saying, something's not right. I don't have the energy I had 3 years ago. I'm not sleeping well. I can't think as clearly, or I don't feel as sharp as I used to. Those kinds of things that a lot of us attribute to, I'm just getting old. But there's answers for those things. And they're not going to come in a complete blood count, or they're not going to come in a comprehensive metabolic panel. You'll have to dig a little bit deeper for a lot of those causes. The tests that are typically abnormal in seemingly perfectly healthy people like yourself and myself are amino acid analysis, stool analysis, organic acids, vitamin mineral levels, oxidative stress levels, food sensitivity and food allergy testing panels, adrenal and thyroid panels. And I lump those two together because these guys, your adrenals, affect your thyroid quite significantly. So some of you in here may be clinically hypothyroid. You're having some hair thinning, you're having you're cold all the time, you're putting on weight for some unknown reason. But then you check your TSH levels, you check your T3, T4 levels, and they're normal, just barely. Mind you, everything's a range. And that's clinical hypothyroidism. But you don't have true hypothyroidism, so you probably won't get a medication. Anyways, that's where you need to dig a little bit deeper, maybe look at your adrenals, or your adrenal glands, and see if those are normal, because oftentimes they're not. So this is what's happening today. These are the tests that a lot of us are doing today that are a little bit different from the norm. an interesting graph. So there's two primary pathways, and there's tons of them in the brain. There's two primary pathways that affect a lot of us. One pathway is the catecholamine pathway, which is responsible for producing dopamine for focus and attention, norepinephrine, and epinephrine. These guys get you out of bed in the morning. These guys put the fire in your pants. These guys get you going. This is for focus and attention. On the flip side of this coin is the serotonin pathway. This pathway is responsible for producing serotonin and melatonin. Serotonin for mood stability, melatonin for sleep. These two pathways are controlled by one connecting enzyme, so it's very important that we keep both pathways relatively balanced. Oftentimes, if you've ever experienced the effects of an SSRI or an antidepressant, you can find that, yeah, you're happy as a lark, but you can't focus on something for 2 seconds because you're just not quite, you don't feel right. And that's what's happening there, is that these two pathways are starting to lean one way or another. Now, same thing happens with children that are on ADHD medication, and adults for that matter. Your dopamine levels start to be just fine, they start to level out, but that means that your norepinephrine and your epinephrine levels also come up a little bit, and you start running a little bit low on that guy, so now you're a little bit more short-tempered, irritable, maybe aggressive, those kinds of things. So it's important to keep these two things in check. Now, if you look at the top of these pathways, they are controlled by amino acids, protein. Phenylalanine, tyrosine, and tryptophan. Those are the 3 amino acids that feed or that start these cascades. And if you have an amino acid analysis that looks like this, and your phenylalanine level is low, and your tyrosine level is low, guys, if you're low here, and you're low here, it is a physiological impossibility to be normal here. It's not going to happen. If you're low here, it is physiologically impossible for you to have normal melatonin levels and sleep regularly. Same stands for that mood stability molecule called serotonin. And when you take that antidepressant medication, it stimulates serotonin release. So this is an amino acid analysis. This is just one of the panels that we run that help us identify if you have a protein deficiency, if you are struggling with digesting or absorbing proteins, breaking down proteins, etc. And that's what's key here. If I see this happening, my goal is not to just load you up with amino acids. Well, that may be the goal in short term. But that's not the long-term goal. The long-term goal, the long-term solution to this is to figure out why in the world are you, whether you're a vegetarian or not, especially if you're a vegetarian, because if you're a vegetarian, you're a little bit more apt to be a little bit low here, but not many people are. So if you're not a vegetarian, why in the world are you deficient in amino acids? And that answer usually lies here in the gut. And you're just either not absorbing or digesting efficiently. So it's important to start to identify those conditions and start to kick over some stones and look under some things and see why in the world are we not absorbing and digesting properly. I'll get into more on that. But so there are a ton of supplements out there. I mean, you can just go to any grocery store and there's aisles and aisles of them. And they're all great for some things, obviously, or they wouldn't be there. However, none of them are going to help you unless you need them. If you are normal in B1 and you go by, or let's say you're normal in all of these Bs, obviously this person is not, but let's say all of these B vitamins are over here, and you go get a B complex because you're not feeling like you have enough energy, that B complex isn't going to give you a lick of energy because you're normal on it. Now this person, if they're feeling fatigue with this disposition, they probably would benefit from a B complex. They probably would help. But if they're this deficient, I assure you there's other things going on in the background. So it's important to just, again, I can't stress how important it is to evaluate. And that's one of the things that we stress. I'm not going to evaluate you by asking you questions and getting a history. That's where it starts, of course. But it's about kicking over stones and looking at blood, urine, stool, and seeing what's going on in your body in all facets, or as many as we can tackle. So this is one of our tests. It's called a NutriVal. It's a huge umbrella test is what I call it. It looks at vitamins, minerals, amino acids, organic acids, and fatty acids. We'll walk you down these individually. So this assesses what you need as far as vitamin and mineral counts go. It looks at your red blood cell nutrients. It looks to see how you're doing with copper, magnesium, all these minerals. That way you can look at your multivitamin mineral and say, hey, I'm good on all these. However, I need 40 milligrams of zinc. This multivitamin only has 10 milligrams of zinc. So you're going to have to go get another boost of zinc, if you will, in order to meet your goal. If not, you're not going to get the benefits of it. And that's what a lot of people find. They'll come to see me and they'll say, yeah, I tried a multivitamin mineral. I didn't feel any different. And usually it's because they are way underneath the mark of where they need to be, dosage-wise. This is a great panel that goes in that NutriVal. This is the citric acid cycle, also known as the Kreb Cycle. This plays a vital role in your health and well-being. This is essentially the energy plan for your cells. This is the TXU of your cells, if you will, or whatever company you use these days. Right? This is how this works. Your body creates energy with food. It will take fats, carbs, and proteins, and it will break these things down into one common acid called acetyl-CoA. Acetyl-CoA will then go into this cycle. And acetyl-CoA will be converted into these different acids. It's not important what they're called, it's important that you know that they get converted into these acids. And what's more important is to know that every single one of these conversions has cofactors to it. A cofactor is essentially the gasoline to go from point A to point B. So when you step on the accelerator of your car, if there's no fuel in the tank, you're not going forward. The same thing happens here. Citric acid needs to be converted into cis-aconic acid, but in order for this to happen, you have to have adequate levels of iron and glutathione in your system. So if you're anemic, you're going to be struggling here. That conversion isn't going to happen very efficiently. And that will affect your energy levels. That will affect your fat burning capacities. That's going to affect your metabolism rate. All of those things are going to slow down. The main cofactors in this cycle, if I had this blown up and you can look at every one of these circles, are B vitamins, primarily B1, 2, and 3. Those are the cofactors for your cellular energy factory to burn. It's the coal of the coal factory, if you will, your B vitamins. So anyways, this is a really great panel, especially if you're seeing difficulty in losing weight, decreased energy, all of those things. Oxidative stress. This is another marker that's in this NutriVal. Oxidative stress is controlled in your body by a molecule known as glutathione. That's the most prolific. We all oxidize as human beings because we live on oxygen. If you look at metal that's left out in the environment, after a few days, you're going to see rust on it. That's the metal reacting to the oxygen that's around it. Your cells do the same exact thing. They oxidize. And they create this thing called oxidative stress. So this is the cell wall that every one of our cells have. It's called a phospholipid modulator. Basically, it's like a peanut butter sandwich. It has a layer here, and inside of here is fat. Now, what will happen when you start to oxidize, think of basically an ember coming out of a fireplace and landing on your carpet, and it singes it, makes it kind of hard right there. That's essentially what an oxidative radical would do to this lipid bilayer. It just kind of singes it, and it will basically inactivate a portion of that cell wall. It won't be open for receiving and and sending out garbage and sending it and bringing in nutrients, it's essentially not working anymore. That little portion of the cell wall. So these two markers, lipid peroxides and AOHDG, are oxidative stress markers. We're all going to have some, you just can't have too many. Glutathione is your major antioxidant. When you cut an avocado in half, you leave it on the counter, it turns black. That's oxidation. If an avocado could produce glutathione, it wouldn't turn black. It would stay green, because when that oxygen reacted with the avocado, the glutathione would repair it. But that's not the case with avocado, because it doesn't have antioxidant properties. Our bodies do. It's just important that we don't oxidize faster than we can antioxidize. So we have to make sure that we keep our antioxidants in our body high. As we age, glutathione levels go down. If you guys ever go to an anti-aging center or something like that, or a rejuvenation center, they're going to stick you more than likely with an IV of L-glutathione, and you're going to feel like $1 million for a few days. Because it's going to wear off. So why not just boost your own glutathione levels? Because you can do it very easily. Glutathione is a tripeptide. It's made up of 3 amino acids. Oftentimes, people are deficient in one of those 3. And then it needs B6 in order for those 3 amino acids to make glutathione. So you give your body the precursors, and your body will take care of building and creating what it needs. But oftentimes, people are deficient in those things. CoQ10 is a vital antioxidant. If anyone here is on a statin medication, Lipitor, Crestor, any of that, that medication, along with decreasing your cholesterol levels, is also depleting your CoQ10 levels. So if you are on that medication, please make sure that you are on CoQ10. 50 milligrams at least, 100 milligrams is better. Again, how much of it do you need? I don't know, that's just a range. But I can sure test your CoQ10 levels and tell you. Vitamin D. Guys, I can count on one hand how many people come into my office with fatigue and not feeling so good and have normal vitamin D levels. It is shocking how many people are deficient in vitamin D. The statistics are 1 in 3 in America. 1 in 3 are deficient. I am deficient, or I was when I got tested. Understand that these genetic roles here, you have an enzyme in your body called a VDR enzyme, a vitamin D receptor. When your body is exposed to sunlight, that enzyme converts that sunlight into vitamin D. That vitamin D receptor enzyme can be mutated, meaning that it's not working very efficiently. It can be mutated about 40%, or it can be mutated about 80%. Mine's mutated 80%. So as you guys can see, I'm in the sun quite a bit, a lot actually, and my vitamin D levels were 13. Normal is 30 to 100. People want to be around 55 to 60. I'm in the sun easily 8 to 10 hours a week, directly in the sun, and my vitamin D levels were 13. I would have never in a million years, if you asked me what mineral or vitamin do I feel like I cannot be deficient in, I would have told you vitamin D, as much sun exposure as I have. But I was in gutter in vitamin D levels, and I was starting to feel not so hot, which is why I got tested. So I understand that these genetic mutations can play a role, and things might not be as you would see. Vitamin D is what I call low-hanging fruit. It is very easy to get up to normal. You just take a vitamin D supplement. You can take it oral, pill form, liquid form. I prefer the liquid form in oil. Just put it in your mouth. Most of it is liposomal. That means it'll get absorbed in your buccal cavity and your buccal membrane. It doesn't necessarily have to go through the GI tract. If you take a pill or capsule, it will go through the GI tract, therefore being less efficient. This is one of my favorite panels in the NutriVal. It's an essential and metabolic fatty acid panel. Everyone here knows that omega-3 fatty acids are good for you. However, which ones? There are a million out there. There are omega-3s, there's evening primrose oil, there is omega-3 6-9s, there are tons of them out there. There's krill oil, cod liver oil, I mean, there's a ton. There's vegetarian sources, if you're a vegetarian, plant sources. This panel looks at your omega-3s, your omega-6s, your 9s, and your 7s. So this person is extremely low in their omega-3s. They're pretty darn high in their omega-6s. They're pretty high in their omega-9s, and they're normal in their 7s. So if this person were to ask me what omega-3 do I need, I would say you need an omega-3 that's high in just omega-3s. You don't need a 369 complex. You don't need one that has 3s and 6s. You just need 3s in order to balance this out. And that's all this is. How do I get this down? If you can't really see up here, but omega-6s come from vegetable oils, grains, meats, and dairy. All of which are high in the standard American diet. Known as SAD. Omega-3s come from cold water fish, flax seeds, and walnuts primarily. Some of us are pretty high in those, but not the average population for sure. And definitely not most children. So this is the typical status that I see with people. Low 3s, high 6s. By the way, those are on a seesaw. When your 3s go down, your 6s come up. When your 3s come up, your 6s will by default go down. So it's pretty easy to get this together. The omega-3 index for this person was a 3.2, they need to be about an 8. This is a really good slide showing you the anti-inflammation properties of omega-3s. You can look at research out there that will show you that high omega-3 levels have a greater anti-inflammatory property than an NSAID, or a non-steroidal anti-inflammatory, over a long course of time, not in the short term. So, if you have a headache or if you had surgery and you want to get your inflammation down, don't go grab an omega-3s because it's going to take time for those to come down. However, if you have chronic inflammatory conditions, arthritis, joint pains, decreased cartilage in your knees, whatever the case may be, omega-3s are a much greater source of anti-inflammatory help than a non-steroidal anti-inflammatory drug like, as simple as Advil. And by the way, it's much better for your GI tract, and there's no possibilities of getting ulcers from giving too much omega-3 like there is from taking the NSAID. Anyways, this is where omega-6 comes from. This is the same thing I just set out earlier today. This is grains, most meats, dairy, anything that's in a box, if you will, is loaded with corn, cottonseed, sunflower, peanuts, soy, canola oils. These oils will turn into arachidonic acid. That is the bad portion of omega-6. Mind you, omega-6s aren't bad. There's just portions of them that are bad. Arachidonic acid produces discomfort, free radicals, degenerative joint disease, vascular disease, arteriosclerosis, those kinds of things. When you take something like Celebrex is a COX-2 inhibitor. It cuts this tie right here. So your body, you can continue to eat crappy, you can continue to produce this horrible arachidonic acid, but as long as you're taking your Celebrex, you're not going to feel this guy so much, the pain, because it cuts that connection. However, as soon as you miss your Celebrex dosage, here comes the discomfort again, because you didn't really fix that, you just kind of plugged the hole with your finger. It's much better to take omega-3, such as EPA, which is a portion of the omega-3. It will inhibit this enzyme, which will stop producing arachidonic acid, or the omega-6. So this is where it's better for you long term. By increasing your omega-3s, you decrease your omega-6, and this is where that seesaw comes into play. However, this enzyme is activated by insulin, so if you're on a sugary diet or you drink sodas and things of that nature, you're going to activate this enzyme and you're going to produce more arachidonic acid. So Just a really cool slide indicating the fatty acid correlations and inflammation. This is something everyone should know. Cold water fish are a great source of omega-3 fatty acids. However, swordfish has about 170 micrograms of mercury per 6 ounces. Fresh tuna has about 68 micrograms of mercury. Canned tuna has 35. Salmon is your best bet at 6.5 micrograms of mercury per 6 ounces of fish. The reason canned tuna has less than fresh tuna, like if you were to order like an ahi tuna steak, canned tuna, the fish that are made into canned tuna are relatively small. Smaller fish, smaller toxic load. The tuna that you use for an ahi steak or sushi even, those fish are pretty darn big. They can get up to 300-400 pounds, even larger. They're going to have a greater toxic load, roughly twice almost the amount of the small tuna. So if that's interesting, stay away from that guy. I saw this on a website. I thought it was really good to show you guys. Just running through it real quick. This is great. There's two forms of cholesterol. Most of you know this. There's LDL, which is the bad, and there's HDL, which is the good. This is what happens in your arteries, guys. The LDL cholesterol will produce plaque and can clog your arteries. The HDL, because some people will say, my cholesterol is a little high, but it's because my HDL is so high because I take a lot of omega-3. That's fine. I'll take a 205 cholesterol level, which is above the norm, as long as your HDL is through the roof and your LDL is relatively low in relation. The HDL goes through these arteries, and they're kind of like the scrubbers. They literally scrub away this plaque, this LDL. HDL comes from omega-3 fatty acids. That's a great source to increase your HDL levels. By the way, this is high-density lipids. LDL is low-density lipids. So the low-density lipids stick to your arteries. The high-density lipids scrub them away. Unfortunately, if you have an elevated toxic load, those toxins will adhere to those HDLs and basically inactivate it. So that's why it's important to be low in toxic intake, high in HDLs. It's a really good way to prevent atherosclerosis, reduce your incidence of stroke, heart attack, and so on. Back, I forget the exact year, but it was like late 70s maybe. They did a study called the Framingham study. They advised that we should be on a low-fat diet. Don't eat fats. That causes heart attack, causes cholesterol increase. Don't eat fats. Eat carbs. That's what they say. That's how much we can change. You should eat carbs. Pasta, spaghetti, pizza, things of that nature. Well, we now know that study was completely flawed and it was completely backwards. When you eat bad carbs and things of this nature, you will increase your inflammation. You will decrease your HDL. You'll raise your LDL. We know that now. It's complicated in the sense that some foods which are high in saturated fat seem to be very consistent to reduce heart disease. That's what's important. So now we know that it's not don't eat fats. It's eat good fats. Eat the fish. Eat the olive oil, avocado, coconuts. Those are good fats. Those will increase your HDL. So it's not that fat causes heart disease. Bad fats cause heart disease. Cholesterol, although it has a very bad rap in this country, you need it. You have to have it. As a matter of fact, in the children that I see with autism, one of the main findings that we see, which is basically 60% of them, 60% of children with autism have decreased cholesterol levels. And when I say decrease, I mean normal cholesterol should be around 150. Their levels are like 98 and 90. Cholesterol is known as the mother of all hormones. It produces testosterone. It produces estrogen. It produces sex drive. It produces stress handling capacities. is extremely important. However, it can't be too hot. But I think a lot of us in the complementary alternative health world know that cholesterol has a little bit worse rap than it should have, actually. Anyways, you do need it. You need the good stuff. You need the HDL, decrease in sky. I think we read this works enough. Good fats are made by nature, bad fats are made in factories. That's a real simple rule. If it's made, it'll probably kill you. If it's made in nature, you stand a better chance. Note here, just a personal opinion, stay away from the palm oil. There's a really cute monkey called a gibbon. If you've never seen one, you should look it up. It's cool, it's all get out. Little monkey, got real long arms, long tail. They live in a habitat that produces palm oil. And boy, they are mowing the habitat down because everyone wants the palm oil. And it's only in that general part of Southeast Asia. Anyways, the gibbons are not extinct because they're mowing down that land. Tons of other fats that you can seek out. Check those little guys. Really good way to assess what you should seek and what you should avoid. Not avoid completely, but keep it low. Inflammation. As I said before, if you're low in things, it typically starts here. Anytime you take an antibiotic, you should follow it up with a probiotic. An antibiotic, it's not bad, they're good for you. By God, if you have a bacterial infection, you need an antibiotic. Unfortunately, those antibiotics don't discriminate what bacteria they kill. They kill the bad and the good. You kill too much good, you're going to start having digestive issues. So make sure you follow up any antibiotic treatment with a probiotic. When you have food sensitivities or food allergies, and most of us have either, if you don't know it, like if I ask you, do you have any food allergies, and you say no, and I test you, you very well may have some, but they may be a very low grade. They go from grade 0 to grade 6. If you have grades 1s and 2s, you may not know that you have an allergy. But you have all these deficiencies and you're not sure why. You have some abnormal bowel movements and you don't know why. This is a healthy GI tract. At a microscopic level, it has these villi. These villi have mucus on the edges of them, and that mucus is where our food gets stuck after they've come out of the stomach and are into the small intestine. The food particles get stuck in this mucus, and then all these little dots in here are red blood cells. When you eat, your small intestine engorges your blood, and those red blood cells go and seek these nutrients. This is a real estate game. It's a surface game here. The more surface area you have, the greater absorption you're going to have of nutrients. If you have some mild inflammation, and the worst thing about this mild inflammation is that it doesn't give you a fever, it may not give you tummy aches, it may not give you bloating, it may not do any of those things. It may just be something as simple as, you know what, instead of having 1 or 2 bowel movements a day, I have one about 1 every 3 days. It could be just as simple as that. What happens at a microscopic level is you have this low-grade inflammation, which essentially takes this floor and it raises it up. So instead of having this nice, long, healthy villi with a bunch of surface area for adhesion of nutrients, you have this villi with this much mucus and this much adhesion for nutrients. So that's why you start running low in vitamins and minerals, and that's why you start needing 5 times the normal levels of B1 or B2 or vitamin D that you may need because you're just not absorbing it properly. We do a stool analysis to assess this. In the stool analysis, it checks for meat fibers, it checks for vegetable fibers, it checks for digestive enzyme levels. Do you have enough digestive enzymes to break down your food or not? If not, you can just take some digestive enzymes whenever you eat. If you have meat fibers in your stool, you're not absorbing protein very well. If you're not absorbing protein very well, you're probably going to have some of those deficits we looked at earlier in the amino acids and start to have some of that focus, attention, sleep, mood, dysregulation. stool analysis, we're going to look at your bacteria flora or your microbiota. These are beneficial bacteria. These are probiotics. The same thing as I said for the fatty acids go for these probiotics. There's a ton of them out there on the market. Which one do you need? Guys, if you're full of bifidobacter and E. coli, but you're low in lactobacillus, and you take a probiotic that has a ton of bifidobacter and only 1 or 2 strains of lactobacillus, you're probably not doing yourselves any favors. And you're probably not going to reconstitute that lactobacillus strain or species in your gut because you're just not quite taking enough of it. There are roughly 7 lactobacillus species and 6 bifidobacter species. So anytime I see no growth in one of the species, I'll try to give you all 7. And if I see no growth, I will also try to give you a prebiotic along with that probiotic. All the prebiotic is a simple sugar. It's like a fertilizer for grass seed. If you have 0 grass, on top of putting grass seed down, you're probably going to put some topsoil and some fertilizer on it in order to help it go. If you have some grass there, if this was like a 1, you can just throw some extra grass seed on it and it'll patch in. You can just throw some extra lactobacillus in there and it should go ahead and get you from a 1 or a 2 to a 3 or a 4 where you need to be. So, probiotics and prebiotics. Those are extremely important. If you have any bad bacteria, depending on which one it is, this lady here had just got back from Costa Rica, had some abdominal discomfort, we ran a stool analysis on her, she had salmonella. So, we had to get her on an antibiotic for that. This is the gut immunology. If you have elevated levels of eosinophil protein X or calprotectin, those are inflammatory markers. If you have GI inflammation, you can bet that I'm going to run a food panel on you following this to see if you have any food sensitivities or food allergies. See what's causing that inflammation. When you have abnormal digestion absorption, you can have all kinds of abdominal discomfort, and that comes from maldigestion more than malabsorption. You're just not breaking down food very well, and now you're getting into your colon partially digested, and that's giving you the discomfort. By the way, this whole gut-brain connection, I'm not digesting very well, so I don't feel very good, I'm emotional, or I'm irritable, or whatever the case may be. We've been talking about a gut-brain connection in the complementary aspect for a long, long time. However, just in 2012, the American Academy of Pediatrics finally did a study that confirmed, yes, if you're not digesting and absorbing normally, it's going to affect you neurologically. So a lot of these things that you're taking, that you're trying to suppress your neurological symptoms for, can be coming from your gut. So instead of taking the long road and saying, well, you know what, for the next month I'm going to go wheat-free, dairy-free and see how I feel. You can just test and you'll know. It makes it a lot easier to be compliant that way. This is an IgG food antibody panel. IgG stands for immunoglobulin G, and these are sensitivities. These are not allergies, they're sensitivities. You can be sensitive to something but not allergic to something. A food sensitivity takes time to manifest. If you're sensitive to peanuts and you eat a bag of peanuts in Walmart, you may be just fine today. You may be fine tomorrow, but holy smokes, come Monday, you can't go to the bathroom, you don't feel so hot, you might even have some bloating. It's a delayed reaction because it takes time for those immunoglobulins to build up. If you have a food, oh, and by the way, this one is one that's not so bad. That was horrible. This is an IgE food panel. This IgE stands for allergy. You can think of IgG for gradual, IgE for extreme. These happen immediately. If you have an IgE or a true food allergy, when you eat peanuts, even though it's a grade 2, you're not going to feel so hot like probably in a couple of hours, if not sooner. So most people that have food allergies know it. Hey, I ate peanut butter, I feel terrible. They go get tested, sure enough, that was a peanut allergy. Low grade, high grade, whatever it may be. If you have a sensitivity to peanuts, you may not know it. So anyways, we do an IgG, IgE test, to identify what it is that's giving you, what's causing that inflammation in the gut that you want to found. Re-inoculation, again, we look and see what you're deficient in, what species are you deficient in. Do you have too many bad bacteria? If we have to kill these guys off first, we will, and then we'll reconstitute that. If you don't have any bad bacteria and you're just deficient in beneficial bacteria, we'll just give you the beneficial bacteria with the prebiotic and reconstitute those levels. And then these are the things that we repair with: glutamine, vitamin, high dose vitamin C, some stuff called Zypan. This is going to be the last one I'm going to do today because I don't want to take up all of your Saturday, but I think this is important one. Adrenals. We talked a little bit about them earlier. This is an adrenal panel. Ray, this is what you did, right?
Yeah.
So, adrenals. Your adrenals are diurnal. They're high in the morning, and then they dip throughout the day. Now, it's supposed to be high in the morning, and it's supposed to dip throughout the day. If you are below that green mark, you're going to experience low endurance and decreased energy levels. You're also going to have a decreased metabolic rate, so you're not going to burn fat as much or as efficiently as you should. This is an example of that. Low cortisol levels, and by the way, that's what these are. These are cortisol levels. Low cortisol levels can give you difficulty waking up in the morning. They can give you hypoglycemia, chronic fatigue, difficulty staying asleep, increased inflammation. These are elevated cortisol levels. Elevated cortisol levels will cause these things. It can also cause some fatigue, it will cause insulin resistance, decreased ability to handle stress, difficulty getting to sleep. As you can see, if your cortisol levels are supposed to be down here, and they're here when it's time to go to bed, you're going to struggle going down. You're going to have that, I hear a lot, my mind just races. I can't shut it off. But of course you can't. Because your mind thinks it's 8 o'clock in the morning. Or it's functioning at that rate. Instead of functioning at 10 to 12. So cortisol is so important. By the way, when you do these tests, it's just a saliva test, which is really cool and very easy to do. You do it at home. You can do 4 samples. You collect within an hour of waking, between 11 and 1, mid-afternoon, and within an hour of going to bed. And we'll see where you are on this graph. This is about as normal one as I've seen the first time around. So they do come back normal sometimes, and it's something else that's giving you the low endurance and the difficulty sleeping and things of that nature. Adrenal support. If your adrenals are hypothyroid, if they are low, we give things like licorice, Romania. If you have high blood pressure, we don't give licorice. We just give Romania to get your adrenal levels to increase. When we just want to support the adrenals, we give things like Siberian ginseng or ashwagandha. These are adaptogens. Licorice is a stimulant. These two are adaptogens. They don't suppress nor do they increase your cortisol or adrenal output. They just support the adrenal health. These are your suppressants. If your adrenal levels are high at night and you can't go to sleep, I'm probably going to give you some Bacopa about 7:30 or 8 o'clock in order to start suppressing your adrenal levels into the night. That way you can go to sleep. So that's how this is treated. It's treated with herbs. This is what we do basically, guys. We prioritize treatment. We try to identify anything that's harming you. We try to improve your diet, heal your gut, restore any nutritional deficiencies you may have. Make sure your antioxidant support is there. This doesn't work on you guys. You're here. At the end of the day, guys, we're all unique individuals. I have seen, I don't know how many people in my practice. I don't think anyone, when I write out a recommendation or supplementation schedule, of the thousands of people that have come through there, I bet you can't grab 2 of them and put them together and they're identical in the dosages and what they're taking and things of that nature. And And just when I think I know what's happening with someone, somebody comes through there and blows my socks off. There's people that come through there that I think are going to be home runs and we struggle with. And there's people that come in there that think there's no way I can help them and they're home runs. So every one of you guys are unique. Your genetics are unique. Your enzymatic function is unique. Your diet, your lifestyle is unique. It's a matter of evaluating all the things that you can evaluate, look over all the stones that we can turn, and then address those things. There are very few linear correlations. I give you this, I expect you to feel that. There are linear correlations with markers. You're low on vitamin D, I'm going to give you 4,000 IUs, I expect that vitamin D to come up. However, how that's going to manifest in you as a person is totally different. I can't say, oh, your vitamin D levels are low, I'm going to give you vitamin D, restore those levels, and you're going to feel like $1 million. Is there going to be something else going on? It's multimodal. So it's a matter of trying to identify as many things as we can, look and find as many abnormalities and fix those. What you and your body does with those fixes, if you will, is left to see. But hope you guys got something out of that. And if you're feeling any of those conditions, man, we sure do look forward to helping you guys out. I'm sitting here as an example of what that can do for you. I had elevated TSH levels, thyroid stimulating hormone. They wanted to put me on normal thyroid. I had elevated homocysteine levels, which cause cardiovascular disease, which cause atherosclerosis, mine were through the roof. So they wanted to put me on Crestor. I had elevated cholesterol. I had elevated triglycerides. And a really good friend of mine is an internist that we work very closely with. And he was like, man, I need to put you on all this. And I was like, well, let's pump the brakes real quick. Let me see what I can fix with natural alternative means. And then I'm going to have you help me with whatever I can't fix. And lo and behold, in 3 months, 3.5 months, everything normalized. Everything. And I'm not saying that medicine is bad. It is a much needed thing in our society. But sometimes we can be a little bit overzealous with it and not fully evaluate the conditions and help ourselves in less invasive means. Again, this is complementary alternative health to mainstream medicine. They complement each other. So, if I can help you guys out anyway, Ray has our contact information. By the way, if you're a member at the Infinity Gym, gosh, you remember what it is, Ray? Like 25% discount?
Yeah, it was 25.
You get a 25% discount on the cost of all the consultations. Cost. If you're with Blue Cross Blue Shield, United, or Cigna, those 3 companies are in network with the labs that we use. We use a lot of labs, but the main labs are in network with those 3 companies. If you have one of those 3, if your plan is in one of those 3 companies, it decreases your cost substantially. That NutriVal test that I was talking about, they just gave us a reduced rate. It used to cost $850. I guess because we do so many of them, they gave us a reduced rate at our clinic, and the cost is like $470. If you're with one of those plans, your cost is like $150. We don't upsell any of our tests. You pay the lab directly. We didn't do anything there. We just gave you the test kit. We performed it. You're going to pay me when I tell you what it means and how to fix it. So we try to be as fair and treat everyone just as we'd like to be treated. We try to be very price conscious with our fees and give you the best deals that we can wherever we can. And then of course, if you don't have one of those 3 companies, then we can discuss other ways to go around the system, if you will. Try to get as many of these markets by going to Quest or LabCorp or your traditional labs, because that can't happen. So, if you guys have any questions,